Hi, Shay. My name is Dina Shadwick. I'm going to be your nurse today. And the doctor has ordered a nasogastric tubal insertion. All right, so what I'm going to do is I'm going to take this little tube. And the procedure is a little uncomfortable, but there should be no pain. All right, so this is just going to go into your nose, down your throat, and into your tummy, okay? So right now, first I'm going to measure so I know how far I'm going to be able to go down with this. So first I'm going to measure from the tip of your nose to the tip of your ear and down to your xiphoid process, which is really just a little bone at the end of your sternum there. So this is going to tell me, I'm going to put this tape on here, and that'll tell me that this is as far as I can go, so I won't go too far into your tummy. All right. So I'm going to lubricate the first 3 to 4 inches of this, so it'll be easier to go into your nose. And you haven't had any problems with polyps or any problems breathing at all?
No.
No? Okay, good. All right, so what I'm going to have you do, I'm going to have you hold this cup. Hold it with that hand. There you go. And whenever I'm going to put this into your nose, about 3 to 4 inches, I'm going to give you a few minutes to kind of get yourself together, and then once I start inserting this tube down into your tummy, I'm going to want you to swallow your water, okay? And that'll just help get the tubing down into your tummy a lot easier. All right? So here we go. I'm just going to put this tubing there. There. Oh, there you go. How you feeling, Shay? Good? Okay, good. All right. So right now, I'm going to have you go ahead and start drinking while I put this tube into your tummy. There you go. You're going to swallow, swallow. Keep on swallowing. You're doing good. Swallow. Almost done, Shay. Swallow. Swallow. There we go. There. How do you feel? You feeling okay? Okay, I'm just making sure that you're able to speak with this in your, down into your tummy. So I got to make sure I got it in the right place. So I'm just going to tape one side of this for now. So there you go. I'm just going to put this up behind your ear. And that'll help keep it in place so this tube doesn't come out. Okay. So the next thing I'm going to do is I'm just going to take a little bit of air, okay, and I'm going to push it into this tubing just to make sure I got this in the right place. Now I've already got it up to 5 to 10 cc's of air. All right, I'm going to put my stethoscope on your fundus, which is basically a fancy word for the top of your tummy. I'm going to push air in there, and I heard a swoosh, so that means I do have it properly placed. All right, let me click that. Now what I'm going to do is go ahead and finish taping this. All right. Now I'm going to take this tape, and I'm going to just be able to pin this tubing to your shirt, okay? So that way you can still move. Make sure you can still move your head. Can you turn your head there? Okay, good. All right, so that we'll keep that in there. Whoops. Yep. All right. Now the one other thing, I need to make sure that what I'm doing, because sometimes the tube will go, excuse me, whoops, actually, you know what I need to do? What I'm going to do is I'm going to go ahead and aspirate a little bit, about 5 cc's of your stomach contents. There we go. Get that clamped. Okay, now I've got my pH strips over here, and I'm going to test the pH and make sure that I've got your stomach contents in this. Make sure that, and that'll tell me if the tubing is in the right place or if it's not in the stomach. Make sure it's in the stomach. So the pH is going to be between 0 and 4, which it is, so that's good. So I've got that in the right place. Now that I know I've got that in the right place, I'm going to get a new syringe, and again I'm going to take about 5 to 10 cc's of air, and I'm just going to pump that in there a little bit to help keep the end of that tubing off of the side of your tummy so that doesn't irritate your stomach. All right. So once that is in place, I can actually unhook this, and I'm going to hook up the suction or the food pump. I'm going to put that on there, get that hooked up, and turn on the pump, and you're all set. How do you feel? Good? Okay.